Hey friends, good morning and happy Monday. Now, this week we're continuing on with eyeImpact and population health, and today I'm going to go off on electronic health records. I know. I already hear the groans from across social media. Oh, EHR, I hate EHR. I hear the doctors right now, give me my paper. I love my paper charts. I'm never switching to a computer. But what I want to talk about when it comes to EHR goes beyond utilizing a computer system to actually enter in your chart notes. I get it. I've worked with a handful of different optometry EHR systems. They can be pretty cumbersome. They can be pretty user unfriendly. They can be comprehensive, but some in particular, you basically need to know how to code in order to customize your system. So there's a lot of improvement that it needs to make from a workflow standpoint. But what I really want to talk about are what can we utilize EHR, an electronic health record system, from a healthcare standpoint, from a practice standpoint, from a population health standpoint. So let's just talk some general numbers. Let's say, so I read somewhere that there's roughly 50,000 optometrists in the country. But just to grossly underestimate some numbers, let's say that 30,000 of those optometrists are practicing seeing patients on a regular basis on an EHR system. So let's assume 30,000 optometrists, 10 patients a day, that's 300,000 exams a day, 5 days a week, 48, say 50, just to make some even numbers, 50 weeks out of the year. So in a week, we're looking at 1.5 million eye exams. Multiply that by 50 and we're talking 75 million eye exams a year. And all of that data is stored in an electronic health system. What could we do with that data? What could we do as optometrists, as ophthalmologists, as primary care providers with the data that is currently sitting in an EHR system that's not being analyzed? What could we do with all of those diabetic patients that over the course of a year, 2 years, 3 years, 5 years, we could identify and track trends to help us stratify those who are at much higher risk of developing diabetic retinopathy? What about a system that actually alerted you, hey, these diabetic patients have, an A1C over 8. They need to be, alerting you to tell you they need to come in every 6 months. What if we actually had robust clinical decision support that could analyze the notes that you're taking and actually spit out, hey, we really need to be looking into this diagnosis and this particular treatment plan. It's been proven in these number of cases. Clinical decision support is not a Google image search that you click on the diagnosis and it pops up with Google images of the diagnosis. That's not clinical decision support. Come on, guys. Let's do better. So EHR, I could talk about this forever. There's a lot of great resources. One great resource is HIMSS, Health Information and Management Services Society, Healthcare Information and Management Services Society. A lot of great resources on how to better utilize technology, EHR systems. They have a whole EMR adoption model. Really important stuff. EHR is going to help us analyze. EHR is going to help us track data, stratify patients, be better doctors, support our clinical decision making, and really just help us be better providers. So I know if you're on the fence about EHR, get it, utilize it, maximize it out. It actually can, and if you pick the right one, improve your efficiency in your workflow. So, hey, have a great week. Let me know in the comments below what your thoughts are. What do you see the future of EMR and how we use it? Take care.